Good morning and welcome to our webinar, Get Moving, Keep Motivated. Today's webinar is about moving, about getting you moving. Exercise has been proven through extensive research to be a vital part of one's treatment whilst living with a blood cancer or a blood disorder. Whether you're on watch and wait, in treatment, in recovery or beyond, healthcare professionals are recommending that you exercise. So even if you were active pre-diagnosis or not, staying moving, how to start moving, and then just as importantly, how to keep moving. Getting started can be daunting and can look very different for everyone. Today, we'll discuss how to set achievable goals, how to know if you need support from exercise professionals, and how to exercise safely. To start with, we'd like to share a recording of some of our people living with blood cancer and their experiences with exercise. At any age, at any stage, any diagnosis of blood cancer, any treatment, let's get moving.
Previous to my diagnosis, I was fairly busy walking because I found out about my diagnosis after a random sort of blood test for my knee operation. I was walking a lot, riding a bike and getting my knee in good shape for the operation, which was postponed.
So I was really active. I was playing tennis, I was jogging 2 or 3 times a week, hiking up Mount Cootha, which is quite large, with a friend of mine. Then I started getting symptomatic and I actually became a couch potato. I was debilitating for me. I couldn't move. And with that, I also found it very, very hard to be motivated in any way to just walk, do anything.
Prior to my diagnosis of acute myeloid leukemia, I was very active, very fit, very strong, very healthy. I was in the gym constantly. I played footy all through the winter, and I was working a really physical job underground in diamond drilling, which kept me in really good shape.
I live on the south coast, so I really enjoyed being out in nature and, doing things with friends, and it was a big part of my identity.
Well, actually, I didn't cope very well at all. I think that I was in shock and overwhelmed that I actually did have a form of cancer. I found that I felt alone with that, even although my family was so supportive. Just moving, I just didn't know how, because I'd always been so active, and all of a sudden, I wasn't this person anymore. I couldn't do what I would normally do. What I could do in an hour was taking me a week. And that in itself was really, really overpowering.
The biggest challenges and sort of hurdles that I encountered, number one, a real lack of energy and I suppose a bit of fatigue, which a really common side effect of your treatment and recovery. Part of it is you've got to give your body time to let your energy levels come back to normal. The other side of it too is make sure when you do your exercise, get your rest. Make sure that if you need to have a lie down after you do some exercise, do that. Make sure you get your rest at night. The other thing that I struggled with as well was a fear of kind of my body breaking down or snapping myself in half or really doing damage. Starting from so far back, and I actually managed to link in with a physio who had a background in cancer patients and helping people like myself, and he was able to put together a really good plan for me and just reassure me that I wasn't going to break myself by actually doing some exercise again.
I had a terrible trouble with lassitude, didn't want to do anything. I felt tired all the time. I could get up and go to sleep in another hour's time.
The challenges that I faced during my treatment regarding exercise were definitely around acceptance of what I was able to do pre-diagnosis to what my body was able to do during the treatment. I was doing or had the same expectations on my body that I had pre-diagnosis at the start, and that resulted in quite significant pain, a lot of days spent where I was so fatigued that I wasn't able to exercise or move my body in a way that served me for many days. So a big lack of consistency. So I dealt with that by sort of reading or feeling how my body was feeling day to day, and doing exercises or not doing exercises that served me, like stretching or Pilates, or going for a light walk, or just resting, having a rest day. I noticed a huge shift in my fatigue levels, my pain. Benefits of exercise during cancer treatment. Heck, I could talk about this forever. I noticed a huge reduction in my levels of anxiety throughout the day. I wasn't so dependent on tablets such as like diazepam or temazepam to manage my levels of anxiety. With that, I felt also more productive and more accomplished throughout the day. So I think that had a residual effect on my levels of anxiety. Quite frequently or every day in the hospital ward, would walk around, do my morning laps, and clients, nurses, carers, family would check in on me, and I'd check in on them, and it was really nice, symbiotic support network, which is good. So I didn't feel as alone, definitely.
Started with little things, just walking to the letterbox and back. That was big for me. That was exhausting. Going out to the garden and just standing on the grass and then coming back in. Having a look at the things online that I could do at home. Just sitting up and down on the couch, not having to do all of the exercises.
First things I tried to do was to work out a program for my exercise which I could manage, which I set, and which was varied. And I really do think varying what you do is really important. You don't have to do something dramatic, you just have to do something. And the great thing is that you have to feel as if you're in charge, because when you have a diagnosis like cancer, you no longer feel as if you're in charge of your own body. The daily pattern of activities I chose was walking. I often took a camera and I took some shots of places I liked. I walked alone and I walked with a stick. I didn't need a stick, but I just felt more comfortable. I did some stretching first, and stretching is easy. You can sit on the seat and do it. The benefits for me, it was just uplifting. I felt my spirits changed a lot. I had more energy, strangely enough. I felt I came back from my walks feeling great. I slept better, and I also felt much more as if I was doing something for myself and I was in charge of my own health.
Once I did start getting back into my exercise, number one, just my energy and my stamina levels were gradually improving. And I started getting, with that I was able to do a little bit more, start getting a little bit stronger, and that just led to more confidence in my body, and that led to me just feeling better about myself and generally happier, and it helped me see that there was a bit of light at the end of the tunnel, which is really, really important.
My oncologist and haematologist was saying to me, exercise will help with the fatigue. But when you're feeling so fatigued and it hurts to walk, it's really, really hard to get started. I now have a treadmill. Sometimes I get on that for 20 minutes in a day. Sometimes I'll do 2 minutes, get off, do another 2 minutes later in the day. But the most important thing is to get up and move, and just walking from one end of the house to the other end is okay.
If you're doing things that you enjoy and that fill your cup, the benefits of exercise increase exponentially, and it's a lot easier to incorporate into your life and be more consistent with it.
Develop a commitment to do this stuff, because it is really good for you. Pick a daily pattern of activity, even if you have to write it down, vary it and stick to it. change the environment. Don't go to the same places. Pick a seat somewhere and sit on it. Get up and walk away from it and come back to it. Pick a pub, same thing. Pick a cafe, same thing. If you have to, and you can post-COVID, you could walk with a friend. Lovely thing to do. Doesn't have to be quick, just has to be steady. And I sort of feel the most important thing is prepare. Prepare yourself for your activity. One thing I did find was that if I got up and put on some runners, put on a pair of shorts, got off a special sun hat, and my body was saying, you're going to do some activity, bud. You're getting prepared for it. And Lordy Lord, I put them on and I felt like going out and doing it.
Just start moving. Be active, where you can within your limitations, because the hardest thing is just having the discipline to get up and move. There's a lot of research and evidence saying that it is really beneficial to recovery, and I couldn't agree more. It's certainly done wonders for me. The other thing I'd really recommend is tapping into someone that can help you put together a plan, whether that's a physio, Leukaemia Foundation, if you need a bit of guidance, and record your activity and what you do as well, because it can often feel like you're going not really anywhere with your progress, and feels like you're going nowhere. And the ability to look back on 3, 4, 5 weeks, 6 weeks even, and compare what you were doing then to what you're doing now, is really important, because you can see that progress, and it's so uplifting, and it will spur you on to do more and to keep going, and that's really, really important for your own self-esteem, self-worth, and how you feel about yourself. But above all, just start moving, be kind, be patient.
Well, I love that. Thank you to Tracey, Lachy, Bernie and Kate for generously sharing. I now would like to extend a warm welcome to our first guest speaker this morning, Associate Professor Camille Short. Camille is a senior behavioural scientist. She works at the University of Melbourne and holds a joint appointment across the Melbourne School of Psychological Sciences and the Melbourne School of Health Sciences, Department of Physiotherapy. She is an affiliate at the Peter MacCallum Cancer Centre, and Camille has experience and training in health, psychology, digital and public health. She leads a program of work focused on the use of technology for improving access to highly quality, personalised and multidisciplinary exercise support for cancer patients. This includes prehabilitation for blood cancer patients scheduled to have a bone marrow transplant. As a behavioural scientist, Camille is passionate about ensuring exercise programs support people to make lifestyle changes by addressing the psychological, physical and social factors that affect exercise and access to exercise services. Welcome, Camille, and thank you for joining us.
Thank you, Caroline, and thank you so much to those that have just shared their stories. I'm not sure there's much more I will add to that. I'll be reinforcing some of it. I think one of the things that struck me is the explanation as to why the strategies worked. And I always find that really important. We often get tips and strategies of things to do, but not necessarily why they might be helpful. So I think that can really help you pick strategies that are useful for you. So I'm going to start just with a few definitions on physical activity, exercise and sedentary behaviour. I will leave it to our next speaker, which is much more adept, one of the most expert people I could think of to talk about exercise prescription and safety for blood cancer, people living with blood cancer. I'm going to focus more on behaviour change, thinking about how we can action our intentions a little bit more successfully. And to do that, I know that you already have a better sense of yourself and the things that influence your behavior than I do. So I'm going to try and give you a framework for how to understand that and go through some strategies. and it will be a little bit interactive to start getting you thinking along this process, and also just so that we can share and learn from each other. So physical activity is any bodily movement. Somebody asked a question about chasing grandkids, doing household chores, mowing the lawn, that sort of thing. Absolutely, it counts. I have 2 small children, and one is 16 kilos, one's about 5, and I can absolutely attest that that is a big part of my exercise, is playing with them. But exercise itself is a subset of that, and it's something that's planned and structured and repetitive. And the reason for that is that it is trying to improve particular outcomes around fitness and strength. So you can get overall benefits from physical activity, and you can track those yourself. If there are certain things that you really want to improve, exercise can be really helpful for targeting specific outcomes. I also just wanted to raise sedentary behaviour. So there's a big movement in the last 10 or so years within the public health space that we shouldn't just recognise exercise, but we should also think about the amount of time that we spend sitting and lying down. And that's because it's been identified as a potentially independent risk factor. So you could be an active couch potato. So for someone like me that has an office job and maybe sits down for 8 hours a day and then goes and does, half an hour to an hour of exercise, I could get more health benefits by breaking up my sedentary behaviors throughout the day, because it has some metabolic consequences. So I think if you're someone who is quite unwell and is finding it hard to do like any real big blocks of physical activity, you can still get benefits from just breaking up sedentary behavior throughout the day. So at least every 2 hours, standing up, doing a little bit of exercise. So we can start thinking about our activity pattern throughout the day, and not just those independent chunks of exercise, in order to benefit from movement. So this is something, Shaza will talk to you a little bit more about the evidence specific for blood cancer, but this is something I come across a lot. We know that exercise is just a very, very good intervention for helping people recover from cancer, prepare for cancer treatments, and live better with the disease. However, as a behavioural scientist, I'm at pains to point out, even if we could put it into a pill, some people would take it. We know that from when we look at medication adherence literature, the adherence rates for taking medication is similar to the adherence rates for meeting the exercise guidelines. And that's because doing any behaviour consistently, especially one as complex as exercise, is really quite difficult to do. And that's why we see what we call in the behaviour change field as the intention behaviour gap. So it's the idea that half the battle might be wanting to form a goal, form an intention, going from an amotivated state to actually wanting to do it. But then we know from all the times we've tried to change our behaviour in the past that sometimes we're not successful. And New Year's resolutions is a common example of that. And the research literature and physical activity says that nearly twice as many people fail to translate their intentions than that have no intentions at all. So there's something going on that stops us from delivering what we would like to. But I really do want to start from a point of hope. We heard from the stories at the beginning that becoming active is possible, and also that improving our quality of life and managing fatigue is possible. And I think both the next speaker and I will touch a little bit on fatigue, because I know it is such a big issue. So what is best practice? Well, when we're trying to change behaviour, we want to have a sense of the goal, what it is that we want to achieve through that. And then to personalise the approach, we need to think about what is it that is influencing this person's behaviour. So you can think about that from an individual level, psychology, the physical things, and then social and environmental levels as well. And then a tailored approach is actually targeting strategies to influence those things. So this is something that is simple, but isn't necessarily something that we do intuitively. So I would like to do just a little bit of an activity with everybody. So to start with, I want everyone to reflect on what it is that you want to achieve with exercise. So it could be a behavior. It might be, for example, that you're wanting to establish a regular exercise habit, a regular exercise routine. It could be that you're wanting to learn about how to do particular types of exercises. It could be about the outcome of the behavior. It could be that you really want to improve fatigue. It could be that you want to be able to, to be more independent. So think about it for yourself. Write it down if you have a piece of paper handy of what it is that you want to achieve. Because the next thing we're going to do is then think about what are the things that influence your ability to do that. So if I can have one of the panelists to put in the chat the link, the first link that I had there. And if you can click in the chat, I'm hoping this works. If it doesn't, we'll move on. But what will generate is, so what you put in will be anonymous, but what will come out is a word cloud of everything that everybody says. And the more people that say something, the bigger that word will be. So just give people 30 seconds. Okay. So it looks like most people are putting in the same things. Motivation and fatigue are the two biggest factors. Time, work, our ability, physical issues, prioritizing, energy, some injuries. Okay, thank you so much, everyone. Keep putting them in if you're still going, because this will keep generating, and this is stuff that we can use too when we're designing programs. So thank you for sharing with us. Sorry, I'm a little bit addicted to watching it in real time. So this is a very simple framework. It's designed by one of the leading behavioral scientists, named Susan Mickey. And the model is that there are three very broad factors that interact with each other to influence any behavior. Capability, that's psychological and physical. So for some of you, you'd said injury and ankles and things like that. That would come into capability. Then there's motivation. Now that's not just our rational selves, what we think we should do. It also captures anything that sort of drives us or repels us from a behavior. So it captures all those feelings. If you have an association with exercise about it being difficult or hard or unpleasant, they're going to be more automatic parts of your motivation. So it captures all of that. And then there's opportunity, and that's everything that's sort of outside of you as a person. Obviously, your ability to prioritize and schedule will impact on opportunity, but it also is things like how far away do you live from amenities? Did your hospital have a program? All those things come into opportunity. So when we're doing our self-audit, we can think of the goals we have. We can use these three things to think, where do I need some more support, if at all? And we can use these three: capability, motivation, and opportunity, in order to kind of get a sense of where we might be able to improve. And then we can start thinking about what strategies specifically we can use to improve those things. So I'm just going to do one more of these audits. If we can have the second link in the chat, this will just ask you questions about how you would rate your motivation opportunity and competence, capability. And I've just seen that some other people have written things in the chat before. Thank you for that. I really will take notes of what everyone's saying. Oh, page not found. Is that what everyone's getting? We've only had one person do it. Okay. Give me 1 second. Can be self-audit. All right, maybe if I can just have everyone write in the chat a score for each out of 1 to 10, 10 being completely motivated, competent, and opportunity. So for each one, on a 1 not at all, 10 completely for motivation, opportunity, and capability, and we can track it that way. If you don't mind, if you want to keep your own response confidential, just keep it on a piece of paper and then check back in with yourself 2-3 weeks later to see if what you've learned today has helped you shift towards some of those things. And I'll share my screen again after I've had a look. Okay, so it looks like we have a real range. And what would be great is if we could learn from each other, other people that have, well, we do have some data. So this is what has come through from the survey. So that's great. There's at least somewhat capability. Motivation, mixed, very. And opportunities. Great, that's quite surprising to me. I'm not sure how many people have been able to fill that out, but that's useful to know. Okay, so I've just got 2 more things to talk to you about from the understanding behavior perspective. And then I'm going to switch gears and then start talking about strategies. But I wanted to make sure that everybody has an understanding of motivation in a way that we can start having more healthy types of motivation, because not all motivation is equal in terms of how well and it is to us, as in how kind we can be to ourselves, and then how effective it is. So this is a model of motivation showing that some motivation is really intrinsic. It's about interest and enjoyment. It's more about kind of our identity and how important something is to us, through to more extrinsic types, which is really more around doing it because you are told to, because you think you should, doing it out of guilt and shame. And what the research evidence shows quite strongly is that doing it because you value it is associated with actually starting exercise. Doing it because you want to is associated with keeping, and because you enjoy it is keeping doing it. So that's not rocket science. We do things because we think it's important, and we keep doing it because we actually enjoy it and get satisfaction from it. So how do we then create an exercise program for ourselves that is enjoyable and satisfying? That's the question that we need to answer. The other thing is, when we're understanding motivation, as I mentioned before, it's not all just rational. There are these other underlying automatic processes, such as our habits, so almost like our default behaviors that are more automatic, and our gut feeling about something. So it's useful to think of this like a jockey and a horse. The jockey is our rational self, and the horse is our biases and our automatic behaviors and our habits. And if you have your rational self, but your horse going off in all different directions, it's going to be harder to get to your goal. So you want to try and make them align. And to do that, it's really useful to understand habit formation processes and a little bit of the science behind that. So I'll go into that just briefly. I wanted to quickly present some of these results from a national survey we did with people living with blood cancer that the Leukaemia Foundation helped us recruit for. We had 134 women, people. Most of them were women. Most of them were active. You can see down on that pie chart the breakdown from the types of cancers that people were diagnosed with that participated. But what I want to show here is that we measured different influences on physical activity, and we tested them in a model to see what were the factors controlling for things like age and gender and income that seemed to be associated most strongly with exercise in this group. And we found that exercising because you feel guilty, so those more external forms of motivation, was negatively associated with exercise. So if that was your main motivator, you were less likely to be exercising compared to people who were exercising because they enjoyed it, because it felt that it was personally important to them. So the question is, how do you not feel guilty about something you believe is personally important for you if you don't do it? So we can maybe talk about that a little bit more. But the strongest predictor that came out was habit. So doing exercise because it's something you do automatically was associated with more exercise, even more than motivation. Those numbers equate to quite large changes in the physical activity score that we had. They just standardized so you could compare them across the different types of things that we're measuring. So I don't have too much time to continue on the self-audit, but I would encourage you to think about what have you tried to address of those things before? How well did they work? And then I'm hoping today you get out what else you could do and where you can get help. So strategies. Before I delve into some of the things, I did want to touch on fatigue. I know it is a big issue and it's a wicked problem in that if you're exercising to help your fatigue, but you're too fatigued to exercise, what can you do? Well, the management of cancer-related fatigue guidelines, first of all, say deal with anything else that might be contributing to fatigue that is modifiable, with the view of then being able to create enough energy to participate in exercise. So that's things like depression, unmanaged comorbidities, pain. If you can seek treatment for them, it can help create the space to be able to focus on exercise if those things are an issue for you. Consider physical activity and reductions of sedentary behavior versus exercise. So being able to do a little bit of light activity based on where you're at. So for you, that might actually be standing up every now and then. That might be where you're at. It might be going to the letterbox and back. You don't have to jump straight away into an exercise regime. Have a tailored exercise program and recognize that it might be non-linear. So it's not necessarily going from completely deconditioned to a super fit superstar in a very linear pathway. You might have good days and bad days, and you might be doing different sorts of exercise on those days, and that's okay. Try some less effortful interventions. So there are other interventions for fatigue. You probably have looked into this yourself. When I looked at the research literature, it seems that these four had some level of evidence. I think there's been 6 randomized trials, for example, on music therapy for people with blood cancer, all in the States. The one thing I wanted to touch on is acceptance and It's based on some work I've done with acceptance and commitment therapy, which is a good psychological therapy if you're dealing with things that are really outside of your control in some sense. So, for example, we do some work with farmers who are experiencing drought. So they have really good coping skills, but they can't do anything about the drought in terms of changing that. What can they do? The same thing we can apply for things like cancer-related fatigue. So it's not just accepting it and being helpless, but it's being able to be present and not fighting, trying not to have the kind of battle with yourself around feeling fatigued and just accepting that feeling. And there's been some research with hematological cancer patients that showed that the severity of fatigue didn't differ, but the impact on life differed depending on whether people had high or low acceptance of their fatigue. So this is just a taster, and I guess a cue to say there might be some psychological support that's available that you can do in conjunction with an exercise program that could help you get to a point where exercise is more feasible. Okay, so we don't have much time to go over the strategies, but they're quite self-explanatory. You might have heard before about setting SMART goals, that they're goals that are really specific, measurable, achievable, relevant, and timed. I'd like to propose open goals as something you could do. They can be a lot more motivating, and that is, it's not just having a vague goal, but it's a goal of let's see how well I can do. Let's see how well I can do today. Planning, I think one of the patients spoke about that before. Once you have written what you want to achieve and you have an idea of what your barriers are coming up, and you know, once you listen to the next talk, maybe around what exercise is good for the things you want to achieve, coming up with a specific plan, what you're going to do when, is really useful tool. This is a quote, somebody else also mentioned monitoring yourself, tracking the outcomes, seeing how you're going. And this is a quote from someone in the survey that showed how just having the fitness wash did help them with motivation. Social support, it's not just about having someone to exercise with. Some people prefer to exercise alone, but it's having someone who is aware of what your goals are, that can help keep you accountable and support you, that doesn't sabotage you. If you decide that what you want to do is, say, something sedentary instead. But it can also be, I call it traps. I like to trap myself into exercise by planning to do it with other people in groups or in pairs. And also I get a lot of enjoyment from doing it. So these are some things for self-discovery that you can experiment with and try if you haven't already. And in terms of how to enjoy exercise, the theory around this is that we all have 3 innate needs: autonomy, competence, and relatedness. And when these are met, we are satisfied. So this has clear implications for how you would design your exercise program for yourself or in collaboration with a professional. You want some autonomy about what it is you're going to do. You want it set at a level that you feel that you have the skills to do it and to progress those skills. And you want to connect. You want to feel that you connect with that person delivering it or the people you're exercising with. If you can satisfy those 3 things, at least the research evidence says you are more likely to enjoy your program. Habit formation, I won't go into the evidence around this, but it is very effective. It was also talked about in the video. It's about doing something consistently and doing it in a set context. And when you repeat that, you start getting the mental association of doing that. So for example, if you start doing something after breakfast and you do that every day, eventually you start, once you get after breakfast, you just get into that flow and you do it, and you don't have that taxing dialogue of, should I do it? When should I do it? Am I really going to do it today? All those things that really fatigue us. Habits and being into a routine can really take some of that away. And there's good evidence that they do work. So consider what you want to achieve. Be kind to yourself. pick your battles and avoid battles with yourself. Consider your motivation, opportunity, and motivation, and select strategies that you think could help with that. And know that physical activity and breaking up sedentary time and exercise are all beneficial. And you can keep that in mind depending on how you're feeling that day. And in terms of getting help, there are exercise professionals. The Leukaemia Foundation is starting to get a sense of in what locations, what exercise professionals have oncology experience, so they can be a good resource. I'd also like to just flag participating in research studies can be a good way of getting access to exercise programs. There's a clinical trial registry that you can use keywords and search. You can join registries to be informed about future research. And in answer to one of the questions about possible online programs, there are a few that I've found out about. I haven't participated in any or audited them, so I can't speak to how good they are, but they allegedly are cancer specific. So I'm happy to share this afterwards, share the slides if people would like this information. And also just point you to some relevant apps. Insight Timer is a good one for mental health and that kind of acceptance side of things. And then there's just some exercise apps that people who participate in the survey have said they've used. And I am over time, so I better be quiet. Sorry, Caroline, I should have kept better time.
Oh, no, that's totally fine, Camille. It was brilliant. I love, you talking about behavioural change. I love the word cloud. That was unreal, created by all of you here. And I really thought you addressing sedentary behaviour and breaking up during the day, because even myself working in an office, you sit and you go, I have to get up, and doing exercise that's planned and structured and repetitive. Fantastic. So thank you very much.
Thank you.
Now, I would like to introduce and extend a warm welcome to our next speaker, Shaza Abo. Dr. Shaza Abo is a physiotherapist and clinical researcher. She's a clinical lead of physiotherapy at Peter MacCallum Cancer Centre and works as a postdoctoral clinical research fellow in physiotherapy at the University of Melbourne. Dr. Shaza Abo has over 10 years of experience as a clinical physiotherapist, specialising in haematology, bone marrow transplant, oncology, palliative care and intensive care in both Melbourne and in London. In 2022, she completed her PhD exploring exercise in adults treated with bone marrow transplant. Her research interests include improving health-related quality of life and physical activity levels in those diagnosed with cancer and in people recovering from acute illness. Outside of her work, Shaza tries not to take herself too seriously, and she aspires to find humour in even the most challenging situations. She also admits to having an addiction to coffee and chocolate. Welcome, Shaza, and thank you for joining us.
Hello, thanks so much, Caroline. Lovely to be here. Thank you to the Leukaemia Foundation and Camille for inviting me along. And I would firstly like to acknowledge that I'm today on the land of the Kulin Nation. So I'd like to acknowledge the traditional owners of that land before I share my slides. So bear with me for a second. Okay. Can everybody see the screen? Yep, getting some nods. Beautiful. So thank you so much again for joining. Like Camille said, I don't know that I have too much more to add from what Bernie, Kate, Lachy and Tracey kindly shared with us from their personal experiences of experience of recovering and going through treatment. So a lot of what I talk about will be very much complementary to what you've heard so far. All right. So I will go through some of the common symptoms and barriers that people have to overcome when they are faced with blood cancer that you'll all, I'm sure, be very familiar with. I'll briefly go into a summary of the research regarding exercise in blood cancer. And then I'll try and focus more on sort of the exercise guidelines, when and how much should you be doing, exercising within your own limits, knowing when to seek help, and then just a couple of useful resources at the end. So I just wanted to acknowledge that I guess the audience today may have a bit of a varied background knowledge around blood cancer. So I wanted to spend just a couple of minutes acknowledging the huge burden that can come along with the diagnosis of blood cancer. And that will just help me preface, I guess, that I do understand exercise is not always a priority, that there are lots of other things going on. So a few stats in that, oops, I skipped ahead there, sorry. 50 people a day are diagnosed with blood cancer, so leukemia, lymphomas, myelomas. It is a systemic disease, and so when I say systemic, it can affect the whole body. And so symptoms are often around the whole body. So different to some, for example, a solid tumour where you might just have symptoms in one part of the body. So again, acknowledging that, you might feel your whole body is letting you down sometimes. And the treatment can be aggressive. So we know that there's chemotherapy, immunotherapies, radiotherapy, and sometimes a bone marrow transplant involved. Treatment can also be long, acknowledging that this might mean a long hospital stay, a lot of time away from home, staying maybe closer to the hospital, and you're outside of your routine, whether that's work, school, playing with your grandkids, like somebody mentioned, those sorts of things. It's away from your usual routine. So essentially, there's a significant treatment burden, and we know from lots of research and from what people are telling us is that there's a lot of physical and psychological hardship that comes with having a blood cancer. So this is just a nice little infographic that one of my students helped me make, Zoe, so thanks to Zoe. But essentially, it's just to give you a little bit of an outline that, we acknowledge that this is the pathway of allogeneic bone marrow transplant, just as an example. But, the point is to show you that there are a lot of medical appointments, even before you might have your targeted treatment. And then there's a long inpatient hospital stay, it might be 3 to 6 weeks, shorter or longer. And then you're closely monitored near the hospital. And then sometimes it can take sort of 6 to 12 months or even longer to get back into your usual routine. And you just feel like you're potentially part of the system. So again, just acknowledging that exercise is not always a priority, or, where do you fit it in? And also acknowledging that it is challenging to find that sort of formal physiotherapy or exercise professional support. And so that's why we're sort of, obviously through the Leukaemia Foundation and through lots of research, we're trying to empower people to support themselves in a way. Some of the common symptoms or barriers to participating in exercise that we see are, like everybody has mentioned so far, fatigue is a huge one. And then there's that cycle of, if you're fatigued, you've got that reduced quality of life, a reduced psychological well-being. If you're less active and not necessarily eating, you might have a loss of weight, loss of appetite, and reduced muscle mass. Sometimes there's pain affiliated with the disease, and sometimes it all sort of culminates in reduced physical activity, and it sort of goes round and round. And just those boxes on the outside of this slide are, acknowledging again that there are multiple confounding factors that can contribute to how you're feeling and your symptoms and your potential barriers to exercise. So it's the cancer, it's the treatment, it's also your background, health status, age, lifestyle, and some personal factors. So just briefly touching on the research in blood cancer. So this is one of the studies as part of my PhD was, I guess, a big sort of review, a systematic review of some of the other research in blood cancer, and specifically in bone marrow transplant. And we know that there's a lot of, a lot of studies focus on a mixed aerobic and resistance exercise program. We're always focusing on that sort of moderate intensity most of the time. And the exercise programs might vary from during hospital admission, pre and post, or across that care continuum. Often the research is about supervised exercise. And actually there isn't too much group-based in the research to date. And so again, just to briefly touch on we all know that that research shows that exercise is really beneficial in blood cancer. So specifically, it can improve your exercise capacity, your health-related quality of life. Sorry, I appreciate there are some abbreviations on these slides. It can improve your fatigue, strength and body weight and length of stay in hospital. So hopefully that reduces too the more active you are. The other nice thing is that historically there has potentially been some concern about exercising when you're acutely unwell or exercising when you're in hospital. And from the research, we have actually seen that there are no significant differences for those people who exercise compared to those who don't in terms of the side effects or your blood levels or blood counts and any sort of weight gain or weight loss. So we know that it's safe and it is feasible. And what do the exercise guidelines say? So exercise guidelines from around the world, and so that's sort of, these ones are specifically from Australia, the US, the UK, and the World Health Organization. They really emphasize, like what Camille said, that importance of really minimizing or breaking up your sedentary time or your sitting time. So I've made this summary table that's sort of, you know, the first row, the first column is about limiting or breaking up your sitting time. So again, like Camille said, if you can try and break up the amount of time you spend sitting, even if that's just short bursts of sitting up and standing. I think Tracey said that when one of the patients in the beginning video said just walking out to the letterbox or even walking from one end of the house to the other, walking out into the sun in the garden, just really simple things like that. And even if walking is too challenging, maybe it's just moving your arms and legs on the couch for a minute or two every 1 to 2 hours. The other sort of focus is when you are able to, is trying to do some aerobic activity. So we know that we should be ideally building up to 5 or more days of the week of sort of 30 minutes of moderate intensity exercise. But again, the focus is on starting where you're at now and building up to that. So you shouldn't be too overwhelmed by just, you know, 30 minutes a day every day. That's not necessarily going to be achievable for everybody. So it's something to work towards. And that's sort of going back to what Camille said about physical activity or exercise not being linear. So you might be at 30 minutes a day at some point, and then you might go down to 10 minutes a day and then go back up. So just acknowledging that as well. The other guideline is around strength training. So strength training helps to build our muscles and makes your muscles work harder, which then can help support your joint stability and also your bone stability. So generally the guidelines around the world aim for 2 or more strength-based sessions per week. And you can alternate that, so you don't have to do, you know, your aerobic and your strength on the same day. So think about what works for you. How do you get started? So it can sometimes feel like you're, you know, at the bottom of a very high mountain to climb. So I always encourage people to start small and really acknowledge your own capabilities at this exact time in your life. So I'm going to talk about how you can check in with yourself on a day-to-day basis. But I think Kate mentioned it in her video that it's really about checking in with yourself. So think about your symptoms, think about your lifestyle, what's going to fit into your lifestyle. Maybe you're back at work, maybe you've got children to look after, that sort of thing. So consider what's actually going to work for you. Be realistic, don't put too much pressure on yourself, and pace yourself. So again, you might need to put frequent rests in. I think Lachy said he needed to lay down sometimes after exercise. So just thinking about not emptying your tank of fuel all in one hit. So, you know, allowing enough in the tank to cook dinner later that night. And think about what you enjoy. Like Camille just presented some of the research around the fact that if you enjoy something, it's going to mean that you're actually going to stick to it and you're going to have more better outcomes out of it. And it is okay to seek help. So it is okay. So how hard should I push myself and how do I adapt? So really what we know from all the patients I've worked with and also from the research is that symptoms will fluctuate, and that can be one of the biggest barriers. So check in with yourself every day. So something that I use in my research but also with our patients is potentially a traffic light system or a rating system. And so this is just an example of something that I use and that you could potentially build into your sort of self-check-ins. But it's really just checking, going, okay, how do I feel today on a scale from 0 to 10, where 0 is where I'm just, you know, really low health status. I've got lots of symptoms. Maybe it's fatigue, maybe it's pain or nausea. Maybe my blood counts are a bit low. That's where you might go, all right, I'm going to do more basic exercises, maybe just seated exercises in a chair, or I can just move my arms and legs to get that blood pumping. If you're in the orange, so that's in the middle of the range, then that means, yeah, I'm feeling okay, but I've got some symptoms, maybe, you know, mild symptoms. So you might aim to complete exercise in that more moderate to low intensity. If you're in that green, so you're almost at 10 out of 10, you're in that sort of good or normal health status, then that might mean that you don't have any symptoms or concerns. You're pretty much in normal self. So why not push yourself to that high or moderate intensity exercise? But like I said, you're going to change every day. You might even change throughout the day. So just adapt and adjust your physical activity or your exercise program to really respond to those fluctuating symptoms. And I'll always be a strong advocate for including a warm up and a cool down. Kids don't necessarily need a warm up and a cool down because their bodies, bounce back and they're really elastic. But when we age, and even when we have some sort of chronic disease or cancer, a warm up and cool down becomes really important for both getting the blood flowing and the oxygen flowing and preparing you to work at your best capacity, but also then cooling back down and reducing the risk of injuries, stretching and getting that heart rate back down so that you're not just rushing off onto the next thing and going, and then going to bed that night and going, oh, I'm a little bit achy or I've got a sore spot. So really, really treat yourself well. Look after yourself. So this is another measure of how hard you should work potentially during your session. So this one's called a modified Borg scale. And this is used a lot in research, particularly in respiratory research, so people with chronic respiratory or lung diseases. But we use it a lot in exercise in general. So it's a 0 to 10 scale, but it's how you perceive how hard you're working during the session. And so, for example, the first column is about aerobic activity. So asking yourself, how hard is my physical effort from 0, which is nothing at all, to 10, which is very, very hard. Now, the scale is a little bit skewed. You'll see that it's, the medium is actually from 3 to 5. So we generally recommend that people work in that moderate to somewhat hard to hard level. So the 3 to 5 that's circled there in the purple. And then guidelines usually aim, like I said, for that 3 to 5 level, but you can use that to adapt. So if, for example, you've done one set of exercise and you go, actually, I'm only working at a fairly light level and I feel pretty good, I could probably push myself a little bit harder into that moderate or hard level. And then it works the other way. So if you're thinking, oh, that was very hard, I might actually take that back a notch and maybe you'll adapt. So instead of perhaps doing squats, you might change it to sitting down and straightening your legs up and down nice and slowly, or just thinking about different ways you can adapt based on how hard you're working, or maybe it's reducing the sets or reducing the time that you're spending. And reflecting back on how you've responded, how your body has responded to each new exercise and each day of completing, even if it is a routine exercise for you. So it's really important because you might have heard of the DOMS phenomenon, so that delayed onset of muscle soreness is a real thing. So check in, do you notice any sore areas? Were you extremely fatigued? Didn't have enough energy to cook dinner? Again, check back in with yourself, consider using that traffic light system and think about it. Do I potentially need to back off for my next session? Or maybe I feel really good and I could potentially push a little bit further. Just again, reiterating that always include a warm up and a cool down. So self-monitoring is just incredibly important. So I couldn't harp on about that enough. Now, considering your safety. So things to think about, and this is really going to be individualized and really depend on where you are in your process in terms of diagnosis, treatment, recovery. But think about, for some people, your blood counts will be a little bit fluctuant. And so you might need to think about, have you had a recent blood test? Pay attention to what your doctors and your nurses are telling you about your blood counts. If they're not doing a blood test regularly, they're probably not concerned and you probably don't need to worry too much about it. But if they're doing regular blood tests and they're saying, oh, your hemoglobin or your platelets are quite low, those two factors are really important. So hemoglobin is really important for carrying oxygen around your body. So we want that to be, relatively high or in the normal range. And platelets as well. So they're really important for preventing bleeding. And so platelets are blood clotters, I guess, in your body. So really important because when you do exercise, the natural mechanism of exercising is that your muscles create tiny little micro tears. And so without getting too technical, those tiny little micro tears need to repair themselves for the muscles to get stronger and bigger. So if you haven't got enough platelets in your system, those tiny little micro tears could potentially turn into a little bit of a bleed. And so without, again, scaring you there, it's just the reason that I put hemoglobin and platelets on there as things to be mindful of when you are in that really acute sort of unwell phase. So that's easy to sort of check in with your doctors or nurses if you are concerned. Like I said, if they're not they're not monitoring it, then they're probably not worried. Medication, so thinking about if you've been warned about certain side effects or restrictions that might be affiliated with the medications you're taking. One example I've got there is some beta blockers. So for example, atenolol or metoprolol, those sorts of medications it might just be that if you're using one of those heart rate monitors or a Fitbit or something like that, it might not necessarily be an accurate measure of how hard you're working. So for that scenario, you might just go back to checking in on that scale from 0 to 10 and using that rather than your heart rate. Another one that people often ask me is, can I exercise with a PICC line in? So if you've got this PICC line in your arm where they're delivering chemotherapy or medications, there's no reason why you can't exercise. We just often advise that you don't exercise vigorously with that arm that the PICC line is in. So you might not be lifting heavy weights if it's in your right arm, for example, but you can still, get on an exercise bike or do a walk, that sort of thing. And then consider any pre-existing injuries you might have, and if you've ever been given advice around working around that, or potentially you're not sure how to work around that and you might need to see a physiotherapist or an exercise professional. And then think about any cancer-specific sites, for example, bone lesions, and I'll talk about bone lesions in a little bit more soon. So then this is more serious safety considerations. So these are reasons that you just definitely shouldn't start exercise, or that you should stop exercise and seek medical help. So if you're exercising and you feel like your heart rate's feeling abnormal to you, again, this is when knowing your body is really important. Naturally your heart rate's going to rise when you exercise, but if it feels really low, it feels really high, or a bit sort of funny, maybe, what we call an arrhythmia, like it's beating a little bit out of control, that's a good note to stop and get yourself checked out. If you have a fall or a collapse, if you become pale or clammy, you're going to become sweaty when you exercise. But if it's a bit of an odd feeling of paleness and, you're going a little bit bluish or grey and you're feeling quite clammy rather than just your regular exercise sweat, or if you're feeling acutely unwell, again, another reason to stop and seek help. If you're getting your new onset of chest pain, I know we have really good awareness around heart health, but chest pain is not always an indicator of a heart attack, but it is something that we shouldn't ignore. If you have any difficulty breathing, if you develop a fever and any bleeding, so again, reverting back to the platelets. So I put a little asterisk there, so it really depends on who's home with you and how severe your symptoms are, but obviously some of these you might need to call an ambulance, some of them might be less severe and you can just go to your GP, but just really wanted to put these out there so that you're not ignoring your body and really listen to these symptoms. When else should you seek professional help? So like I said, any of those things that I just mentioned, and also like I said, know your body, and so that you can recognize what's abnormal for you. If it feels a little bit off, it's really safe. The safest thing is to seek medical help or to exercise under supervision of a professional. And that will just give you the confidence that, what you're doing is not putting you at risk. I wanted to talk specifically about bony lesions just briefly, because I know one of the questions was about multiple myeloma, and if you have a lesion in part of your spine or another part of your body. So from research, very recent research, and sort of lots of exercise professionals and doctors have put a lot of work into this. It's recommended that you exercise or complete any new programs under supervision, mainly to ensure that you have the correct technique. So for, including that your back posture is in, you're looking after your back and your spine. You might need some walking aids like a frame or a stick. I think Bernie mentioned that he used a stick, not necessarily because he needed it, but for confidence. So again, that might be something that you are recommended if you do have bony lesions, or sometimes braces might help to reduce pain or risk further damage. And often sort of general rules, if you do have bony lesions, depending where they are, we often instruct people to avoid higher impact activities. So like jumping, kickboxing, those sorts of things, and any end range of motion. So that's when you potentially, for example, a squat, if you're bending all the way down to almost the floor level, like a deep squat, that's sort of end range of motion. So if you do have bony lesions, we'd often recommend that you back off a bit and maybe do a quarter squat, for example. Often we advise to avoid twisting, bending, overhead reaching, pushing, pulling, and lifting heavy weights. So this is all quite specific, but sometimes can be vague if you're not in the situation. So again, that's why we recommend seeing an exercise professional if you do have bony lesions, and just going to them with any of the scans that you might have, or any letters from your doctors, or often they'll actually have a conversation with your doctor before they start your program. And what about pain? I think one of the other questions prior to this that people sent in was something about pain. So it's really important to acknowledge the type of pain that you have. So if it's sharp, if it's neurological, and by neurological in nature, I mean sort of tingling, pins and needles, sharpness can be a sign of neurological or nerve involvement. And if it's persisting pain, or if it's new pain, those are real reasons that you should not push through. So I know there's that old saying, no pain, no gain. In this scenario, there is actually definitely no gain if you push through pain. So, pay attention to new, persisting, or neurological or sharp pain, and go and get that checked out with your doctor, because it might sort of go back to those bony lesions potentially compressing on a nerve, or potentially risking something that you can otherwise avoid. How do I overcome barriers? So I put a picture of an elephant here because my partner often says to me when I'm feeling a little bit overwhelmed, how do you eat an elephant? It sounds really lame, but one piece at a time, one bite at a time. So start really small, pace yourself, break down long or heavy tasks into smaller, more achievable tasks, more realistic tasks. And again, going back to short bursts of activity. So even if it's sort of 3 to 5 minutes of walking up and down the house and then going back onto the couch, or lying down again. So pace yourself, have rest throughout the day if you need to. Think about, like what Camille said, any other factors that might actually be impacting on your fatigue that could be modifiable. So for example, your sleep, are you potentially not getting the best sleep? Are you having, are there sleep hygiene techniques you could use? For example, a more appropriate day-night routine, so avoiding sleeping in the daytime and just focusing your 8 hours during the night. Are you getting enough energy from your food intake? So it's something to think about, maybe seeing a dietitian to maximize the energy from your food. Consider physical activities that you would enjoy. Again, we've talked about this a lot, but I think it was Tracey said that she really enjoyed gardening. So even, gardening, things that might create joy for you. And consider those welcome distractions. So maybe listening to a podcast, or walking with a friend, or maybe it's folding the washing, but only putting one t-shirt away at the time, so that you're sort of distracting yourself by going to and up and down the hallway. And again, just be kind to yourself, give yourself a break, and really reward yourself for those little achievements. So I think Lachy mentioned having a diary or a little calendar to sort of mark off your achievements. And that doesn't have to be a big achievement. It might be that, walked for 3 minutes today, and then 5 weeks later, it might be that you walked for 30 minutes. So, it takes time to build up, but you can record it and be kind to yourself and reflect back. Just briefly, I will touch on when is the right time. So, you might be feeling like, before my treatment is, too soon, or during my treatment, I'm not well enough, and following my treatment, I'm too tired. So I just wanted to touch on the fact that there is lots of research to say, first of all, exercise is safe during, pre and following treatment, so at any stage. So we know that pre-treatment, the stronger you are, the more active you are. Prior to cancer treatment, it puts you in a good position to tolerate the treatment. And exercise prehabilitation, or that treatment exercise, can actually help enhance the the treatment effect as well. We know during treatment that there's some evidence to suggest that being active during treatment helps you tolerate your treatment better, so that might reduce the symptoms, and it might even enhance the effect, but that's still emerging evidence, so watch this space. And then following treatment, we know that exercise helps with recovery, that survivorship phase, so improvement in both psychological and physical well-being, a lot of those things that I said at the beginning. But like I said, the main thing is that exercise is safe and feasible and has benefits across the whole continuum of your diagnosis and treatment phase. So it's never too late or too early to start or restart exercise. I'll just be a minute or so longer. So I wanted to just show you this example graph of the sort of, going back to what Camille said, the benefits of consistency and also that prehabilitation. So prehabilitation is sort of exercising before a big event. And so it might be before you start a chemo cycle or before you have a transplant or that sort of thing. So this blue graph just shows from one of the studies we did is a walking distance, and it shows that the people who, I guess, were fitter at the beginning of the program, so on the far left of the graph, actually, the left graph is about attendance. So that one's about consistency. So the people who attended more consistently, so that top row, people who attended exercise 3 times a week, even though they did dip during treatment, they actually came back and recovered to a higher level than the people who attended less frequently. So the bottom line is those who attended less than 2 times a week. And then, sorry, the pink graph or the red graph on the right-hand side of the screen is about frailty. So that's about your pre-treatment sort of fitness. And so this is an example, like I said, in one of our studies in bone marrow transplant, where those who were fitter at the beginning of the transplant, so the top line, even though, again, they did dip, after transplant, they came back better than those who were sort of at a lower level at the beginning. So again, this is sort of just a visual description of how being fitter at the beginning and also being really consistent with your exercise can have positive outcomes towards the end. So finally, just a few take-home messages. Really, I just wanted you to really acknowledge and respect your symptoms and work with them. Start small. Seek professional help when symptoms are persisting or new or seem abnormal for you. So that importance of really knowing what's normal for you. Consider what works for you. So think about your own capabilities, your own motivation, your lifestyle. So we know there are physical and psychological benefits to keeping active, regardless of whether that's a little bit or a lot. And it's never too late or too early to start your physical activity program at your own pace. And there's a couple of resources there, which is just a whole chunk of words, but I'm happy to share these slides. So thank you.
Well, thank you for your amazing insight, Shaza. Yeah, when you are living with a blood cancer, there are multiple factors that you can be quite overwhelming to create barriers to your exercising. So I loved you going into the exercise guidelines because it can be really tricky to do this, but knowledge is power. So thank you very much and fabulous. Thank you both for your comprehensive presentations. So now for our live Q&A with Camille, Shaza and Kate. So Kate was one of the stars of our recording earlier in the webinar. Kate was diagnosed with PCNS lymphoma in March 2020. Primary central nervous system lymphoma. It's a disease in which malignant or cancer cells form in the lymph tissue of the brain and or spinal cord. So Kate was diagnosed with 3 tumours in her brain. Kate is an occupational therapist and has recently returned to work and loves her job. She describes herself as someone who loves being outside and adventuring, and she certainly lives an active life. So thanks for joining us live, Kate. And I'll hand the reins over to my fellow blood cancer support coordinator, Sarah, to host our live Q&A session. Take it away, Sarah.
Thanks, Caroline. And thank you, Camille and Shaza, for those wonderful presentations, and welcome, Kate. We have received lots of questions, so we'll aim to get through as many as we can. So the first question, someone has written in to say, I mourn the ability I had to be a really fit person. Now everything is an effort. Wow, I mourn the ability. What an emotive statement. For people who have a chronic blood cancer, for example, MDS, where the disease impacts your physical ability and is unlikely to improve, can you suggest ways to best manage this from a physical and a psychological point of view? Camille, would you like to answer this first?
Yeah, I'm happy to, although I'd love to hear from people who have a lived experience of what is working for them. Partly that's why I wanted to put up the acceptance slide from a psychological point of view. I think there's nothing worse than when you have a significant issue, people telling you to accept it. And that's not what I mean. It is more of a psychological approach to dealing with it, and about kind of being able to it's a value-based approach. So it's really focusing on what are the things that you value in life and trying to commit to those whilst being able to accept where you're at. And I think having support of someone to do that, I wanted to mention the chronic disease management plan, that you can access psychology through that as well. That would be my advice, is to try and get some professional psychological support.
Absolutely, thanks, Camille. Shaza, would you like to have a comment as well?
Thank you, Sarah. I mean, I reiterate what Camille said. Sometimes having somebody professionally support, and you can use those chronic disease management plans, so very good idea. But you can also call your, obviously, blood cancer support coordinators for help as well. But in general, everybody's journey is going to be really different. So I don't think I have the answer that is, necessarily going to answer for everybody. But I think it's important to get your really individualized approach. And if you do have the capacity to go and see a professional to help target your particular approach, I think that's really useful. But otherwise, it's, I guess, to get back to your, mourning your previous self, there's a little bit of acceptance that potentially you need to alter your expectations to a degree, but also that you can potentially have little wins along the way. But again, I'd be really keen to hear what Kate says, because she's lived through it more so than I have, obviously.
Absolutely. Over to you, Kate. What's your opinion on this question?
Yeah, it is very individual, definitely. I think I got so much out of speaking with the counsellor, and that really helped with my acceptance, sort of being out, not needing to put too much thought behind exercise pre-diagnosis, to really needing to think about it and having repercussions if I push too hard, and sort of continuing those exercises throughout regardless. Really sort of, it was hard to get through that. So as soon as I was talking to a counsellor and I learned to accept the season of my life that I was in, or the chapter that I was in, was really beneficial for me.
Lovely, thanks, Kate. Another question, can I expect to return to my pre-diagnosis energy levels after treatment? And how long can I expect this to take? Shaza, did you want to answer that?
Oh, that's way too specific. I don't know if I can answer that. Again, this sounds like a bit of a cop-out, but everyone's journey is going to be so different. I don't know that I have an answer, apart from that everybody is going to be really different, and that you, in an ideal world, would be able to get back to your pre-diagnosis levels of energy, but it might look a little bit different. So you might have those levels of energy, but potentially you're doing a little bit less physically, or you're doing a little bit less mentally. But it really depends on your diagnosis and your treatment, and your I like what Kate said, just to borrow her term, your season of life. But it really is going to be supremely individual, and that's kind of all I can say. But I would try my best to get there if I could, and I would get the support to help me get there.
I think if I can jump in, what really helped me was the spoon theory, and knowing, so I have like 10 spoons, for example, to distribute through the day, and what tasks are most important to me. And for example, exercise might be a heavier physical task, so it'd take 3 spoons, and I'd only have a few spoons left to designate to other tasks or other more important tasks throughout the day. So it was a really good way of me being able to prioritize tasks, and whether or not exercise was one of those things on my priority list for the day, and it helped me plan out the rest of my day, just to make sure that I didn't run out of gas or battery halfway through and was disappointed.
Absolutely. Camille, did you want to add anything?
Yeah, I did have a look at the research literature to try and answer this question, and it seems like for some people it can, resolve in 6 months or 1 year or 2 years, and it's sort of a mixed message, because it means that for some people the energy levels get back, and for other people it's not. but it does suggest that there are modifiable things you can do. And what I mentioned before is that if you are not quite back to where you are, it does seem at the very least that you can manage it and be satisfied with how you're managing it and still feel like you're living, you know, a full and valued life.
Great, thank you. Shaza, you mentioned some warm up and cool down exercises, how important they are. We had a quick question in the chat. Is there any examples that people can do as a warm up or cool down?
Sure. I like to start with warming up your core, so your torso. So getting your muscles that were going to help with your breathing. So I generally start with sort of a little bit of a shoulder roll, some gentle sort of neck rotation, and often some thoracic rotations or trunk rotations, anything that sort of gets your, your trunk, so the muscles around your rib cage warmed up. And then I'll often do a little bit of walking on the spot and then just gradually increase the speed of my walking on the spot. So if walking on the spot's not your jam, you might walk up and down the hallway. There are, I believe, on the Cancer Council Victoria website, there is a really basic exercise program, and that includes some warm-up exercises too. And so it's sort of more about getting the blood pumping. And so that's why I really activate the muscles around your heart, because that's sort of helping to access them quicker.
Lovely, thank you. And then I might squeeze in one last question. What is the effectiveness of online exercise groups, and can you recommend any I could join? Shaza, we'll go with you first.
Oh, I think Camille has some online exercise group advice.
Do you want to go to Camille?
Yeah, thanks, Shaza. The effectiveness is just as good as the telehealth programs, which have got a lot of information because of COVID. They're doing quite well. Sometimes adherence is less, but it really depends on how well facilitated they are. So by all means, they can definitely be effective and so beneficial. I did put up on my slide, I'm happy to share them again, 3 exercise physiology run online programs. I know one of them has a face-to-face session first to help you get the technique right, and that was based in New South Wales, so that one won't be relevant for everyone, but I am happy to share them. We also are, this is what I said about clinical trials, so we are running a trial at the moment post bone marrow transplant, and I'm doing one before. Sometimes they're for specific hospitals, but sometimes they're national and via telehealth. So it is useful to try and keep an eye out for those trials as well, because it gives you free access to kind of research developed, quite good quality programs. And I'm happy if anyone wants to email me, I'm happy to try and link them in with something.
Thanks, Camille. And Kate, did you do anything online at all?
No, I didn't do anything online. I mean, I did lots of Googling and all of those things that all cancer patients do. But yeah, a referral with an exercise physiologist. They gave me a lot of golden nuggets at the start, especially with my blood count levels and things like that. I had really significant fatigue at the start and sort of realized that my hemoglobin levels were very low. So they gave me like the range, anything under 90, the rate of exertion that I was to sort of aim towards. And yeah, it was typically like 80s down to the 60s. So yeah, that was a really good tool that I used to sort of guide what type of exercise I was doing through the day.
Lovely, thanks, Kate. I think that's probably all we've got time for with the questions, and I'll hand back to Caroline for final thoughts and the wrap up.
Thanks, Sarah, and thanks, Camille, Shaza, and Kate. So I love Kate's comment on accepting this season of my life. It's fabulous. And also the spoon theory. Haven't heard that before. So tend to use up across the day, plan and prioritize and pace yourself. So very quickly, Camille, Shaza and Kate, can you share just one key message for the audience to take away from today's webinar from each of you? Very quick.
I'm going to take Pearl Lee's comment and say mindfulness and motion. That sounds pretty good to me.
Yeah.
I'm going to say be kind to yourself.
Mm-hmm.
I'm going to say motion is lotion.
Love them all. Thanks, ladies. That's great. So we've heard an incredible amount of valuable information from our excellent guest speakers today and insight from our 4 consumers and even more from Kate. So that draws our webinar to a close. I'd like to take this opportunity to thank the supporters of the Leukaemia Foundation, as without them, we wouldn't be able to deliver education events such as these. Our guest speakers again, we thank you for your generous sharing of your knowledge, expertise and time with us today. And most importantly, all of you here living with blood cancer who have joined us today. We encourage you to use this information to start conversations with your healthcare team, your family and your friends to help guide and improve your health, recovery and quality of life. So thank you, get moving, get motivated and have a great afternoon.